Hello, everybody. This is Dr. Jon Harmon. It's a good day when I got my guitar shirt on. There it is. That's my guitar shirt. It's summer. I only have a few more chances to wear it, so I'm wearing it today. We have a very special guest today who has become not only a colleague, but also a friend. He moved from California. We're really glad to have him in our area doing the good work that he does. I want to do a little bit of an introduction. Dr. Gerald Roliz is the owner of the Natural Health Improvement Center right in Meridian, Idaho. He's a naturopathic doctor, a chiropractic doctor. He'll tell you a little bit more about that. He's a father. He's an author. He has an awesome book that he'll tell you a little bit about and what's in that book. My purpose today is I want you to get to know, first of all, who Dr. Roliz is, what he does, what makes him tick, and what makes him different than what you may be used to. And Doc, I got to tell you, I've seen muscle testing for 50 years. About maybe 45, but you're on a level of your own. I've not seen someone with the expertise of muscle testing that you do, and I want you to, as you're telling the audience, what is that? I mean, why is that different? What do you do? And so we'll start off with just having you tell us a little bit about yourself, and then I have some specific for you.
Sounds good. Yeah. Well, first off, thanks for having me. And I'll just let everyone know that I'm on my way to becoming a doctor. So I'm in the progress of getting that additional degree. And so I fall in this category of being a natural health practitioner, and our main modality is functional nutrition. So I like to just start off with my background. How did I get into this field? And it ultimately went back all the way to when I was younger. My mother was diagnosed with a disease called idiopathic lupus. Lupus is an autoimmune disorder, and most medical doctors will claim that it's the immune system attacking the person's physical body, as if the immune system didn't know what it's supposed to do. And in most cases, it is confused, but they label hers as idiopathic, meaning they didn't know the actual cause. And so unfortunately, when I was younger, my mother was an experiment to her medical doctors, because if they didn't know what the cause was, then every drug, every surgery, every injection that they administered on her was considered part of the experiment. And unfortunately, when I was younger, when I was 17 years old, she one day started coughing up blood, and I went home to get ready for high school. My brother and my younger brother, younger sister, we went home, get ready, and she went to the hospital with my father, and they couldn't stop the bleeding. And unfortunately, that prevented her from breathing, and she passed away when I was in high school. So, ever since a young age, I was always on this quest to find what is a cure to her health issue. What is the root cause ultimately? Why? Why did this happen? Because at the end of the day, I'm driven by the question of what is going on at the root level. What is the bottom line? What is the reason for anybody's health challenge? And so I did get accepted to UC Berkeley, and I actually studied medicine, pre-med. I was pre-med. I was on the path to go to medical school, because at that time I only knew about conventional medical care, just Western medicine, just drugs, surgery, radiation. That's all I was exposed to. I wasn't yet exposed to naturopathic medicine, chiropractic, acupuncture, neurofeedback. I wasn't exposed to any of that. And so that was my direction. And before I graduated from Berkeley, I actually realized that Western medicine is governed by money, governed by finance. And I don't know, you've probably seen this all over with all the advertisements on the radio, on YouTube, on the television, on the buses. I mean, they are everywhere. And so I graduated because I, had to move into that next step and moved into pharmaceutical sales. I became a pharmaceutical sales rep. I actually had a colleague of mine. He had a company car. He had a corporate credit card where he spent so much on season passes to your favorite football teams, baseball teams, musicals, restaurants, you name it. So I got into this life of going from a starving student to interacting with these medical doctors who I thought I could take out to dinner and learn about treatments and cures to lupus and find a little bit more understanding. And what I found after doing that for a couple of years was I could literally influence doctors' prescribing habits based on what restaurants I took them out to, because I was spending about $5,000 a month on food. And then I also realized that the doctors I was taking out to dinners still didn't understand the root cause to lupus or many health problems. They were just prescribing drugs to suppress symptoms and recommending surgeries to remove organs that we all need, and so then I got disenfranchised with my role, and I really realized that I was actually harming people. I wasn't creating solutions. And I moved to Asia and completed my master's degree in business. And that's where I got my first chiropractic adjustment. So I know, you being a chiropractor, just have that joy of just seeing people's nervous system light up and have amazing communication between the brain to all the organs. And I received my very first chiropractic adjustment while I was out there. And I started receiving acupuncture, started meditating, and started changing my diet, started conducting purification programs on myself, cleanses, and I resolved a lot of my own personal health problems. And when it came back stateside, I found practitioners and clinicians just like yourself and many of our colleagues now who do the work that I do, which is implementing functional nutrition and herbology to help people rebuild. And I found these practitioners, and they help clean up the rest of my own health problems. And I thought, this is amazing. And since then, I've been since 2009, devoted myself to learn as much as possible about the innate ability for the body to heal. And my focus is functional nutrition. Obviously, I receive chiropractic regularly, acupuncture regularly. My two kids, who are now 7 and 10 years old, have never really missed school due to illness. They've never had to take sick days. They receive chiropractic once a month. Ever since they were 2 weeks old, they are taking specific herbal and nutritional formulas. We try to do everything to create a good healing environment at home, and help them grow and reach their potential. And so ultimately, I'm in this field now because I wanted to find the root causes to why my mother passed away. And I uncovered those, and I found those. And now I'm on a greater mission, which is to help as many people be healthy and happy.
Wow, that's a great story. So I thought it was illegal for drug reps to buy things for medical doctors.
There is an organization, I talk about it in my book. There's an organization where they monitor all the pharmaceutical sales and marketing practices to do whatever they can to ensure that it doesn't look unethical. And unfortunately, there are always loopholes. And this organization is made up by representatives of every pharmaceutical company. So it's the pharmaceutical companies regulating their own ethical standards of how much they can go and influence, or they call it educate, but it's really influence or possibly bribery, because if I'm taking a medical doctor out and spending, $500 on 3 of us and not even blinking an eye at the cost because it's going to be expense on my corporate credit card, that's borderline bribery, and I would say it's somewhat unethical because it's someone else's health on the end of that sales transaction. So, but they do have these, I think they have certain websites that monitor how much a doctor receives as a grant from a pharmaceutical company. They have outlawed a lot of activities. When I got into the industry, they stopped enabling season passes to the 49ers or the San Francisco Giants or musicals. They stopped that and restricted just to restaurants and meals. And I spend about $5,000 a month on food. So really at that point with meals, there's no limit. Just think about how many high-end restaurants I ate at.
Wow. Especially in Southern California, they were probably pretty Southern, right? Or was that Northern?
Yeah, I was in Northern California. So I was in San Francisco. Yeah. I was at Boulevard, Ruth's Chris. I was just at, I was at Straits Cafe. They've got a couple locations, and there's a lot of good restaurants out there. But yeah, it's unfortunate that that's how the business was conducted.
Whining and dining. Yeah. Well, we're glad you're on this path. We, Dr. Roliz and I, we do different things. And I have patients who come into me, kids who have severe toxicities that they need to deal with before their brain can get totally better, that we do in my practice. So I'll send them down to Dr. Roliz and say, hey, check this youngster out. I think he might have some toxicities, and sure enough. And then Dr. Roliz worked with them and the parents and get their brain, detoxed of all of those things. It's very important. Could you speak to some of those symptoms that you see in those kids, Doc?
Yeah, absolutely. So look, you asked the question in terms of like the assessment tools and muscle response testing. And, and first off, I enjoy seeing the successes that our mutual patients get from receiving your services with the laser and the neurofeedback. And then over here, when they have the proper herbs and nutrition to not only chelate and heavy metals and chemicals, but also start to rebuild tissues, right? Everybody who comes through our program is receiving specific foods to help their bodies rebuild from the genuine replacement building blocks that can only be found in actual whole foods and herbs. And so, the work we do is we oftentimes see individuals who have symptoms that are neurologically related. And that can be due to toxins in the nervous system, in the brain, in the spinal column, in the peripheral. And this can be observed as symptoms of ADHD, symptoms of autism or being on the spectrum, symptoms of PANS and PANDAS. These are all neurological, psychiatric related disorders. And we'll see individuals come with symptoms of all these sorts. And through our muscle response testing, and I do also incorporate lab work. So I train practitioners across the country on how to interpret blood work, saliva testing, hair mineral analysis, urine analysis, stool tests, but I also muscle response tests because it gives us even more information energetically to figure out exactly what are the specific issues. And I'm trained in 5 different systems, and I don't need to go into further with that, but we want to uncover what are the root causes. And oftentimes with individuals who have a lot of neurological challenges, I find a lot of heavy metals and a lot of chemicals are in those tissues, and they can cause overfiring or underfiring of the nerves. And for your audience, I'll give you a quick example is, some people want to understand the connection between the nervous system and the muscles. And if you ever see anybody out there who has like an eye twitch, their muscles spasming, any muscle that's spasming or twitching, and it's not within the person's actual conscious control, that is not a problem with the muscle. It's a problem with the nervous system connection from the brain to that muscle. And so that little flicker is a hint to anybody out there that there is possible toxicity within the nervous system. Okay, now there are other aspects that the nervous system controls. So some children who have some neurological challenges may also have challenges with continence, urinary or fecal incontinence. That is essentially where they can't hold their pee. They are urinating, they're having to wear a diaper all the time. And we see that also with elderly individuals when their nervous systems start to get very toxic, and because it's the nervous system that controls every sphincter. It's the nervous system. You and I are not consciously thinking, oh, don't poop on my pants, don't poop my pants,
Thank goodness.
Yes, and that's our nervous system, right? That's our autonomic nervous system doing that for us. But when it's not doing it right, that's a problem with the nervous system, and there's actual toxicity that needs to be addressed. So that is an area that we will assess. We find out, especially with these children, these young children who maybe are clumsy, klutzy, loss of balance. Oftentimes we see problems with the cerebellum, okay, the occiput region of the brain. We have individuals who lose the ability to speak, or they have delayed speech, or instead of forming full sentences, they're only speaking in sentences of 2 words, or they only repeat what a parent says. They don't really actually respond to a question. And we look at the inflammation, if there's any inflammation or any toxins around the Broca's region of the brain. There's a condition called Broca's aphasia that I learned about in my neuropsychology classes at Berkeley. And that area controls speech, and so oftentimes I will see individuals who are speaking, and then they have certain exposures to heavy metals and chemicals, and then all of a sudden they stop speaking. Usually I'm checking that particular area through my muscle response testing systems. And of course, these individuals can be taken to a medical professional, have an MRI done, and which can be pretty traumatic for a child, but sometimes visual imaging can be quite helpful to just gather information. And then when people come in, we find out what the root causes are, what's causing the inflammation, and then we create a design clinical nutrition program that includes specific formulas that are food-based, herb-based, even some homeopathy to help with some of the kids, because those are drops that are very easy to get into the body.
I love the way you explained that overfiring or underfiring. It's kind of similar to the way I explained the brain. You got too much activity or not enough, that's where you get symptoms. And so that's I appreciated that explanation. I wanted to ask you another question. I know you've talked about the 6 barriers to health before, and I think it would be really helpful if you explained that to the listener.
Sure. Yep. In my world, there's 6 barriers to healing. I stay within the physical realm. And the first is nutrient deficiency. If someone were to stop eating for 3 weeks, the organs will start to shut down. So clearly, malnutrition can have an impact on the body. Now, most of the people come in my clinic are eating foods that are highly processed, overcooked, have added chemicals to them. So they're not eating the same foods that our ancestors ate that kept them healthy. And when we think about, there's just a concept, like I'll introduce you to concepts. There was a time where people were scared of cholesterol. They didn't realize that the body makes cholesterol, the liver makes cholesterol, so we can have good hormone balance, so we can have a strong brain. And so a lot of people really feared cholesterol. And so they stopped eating the egg yolks and they just ate the egg whites. Now, in my world as a nutritionist, the entire egg provides all nutrition for any living being, because if you have a fertilized egg and you incubate that, you'll get a living chicken. But if you separate it out, if you just took the egg white and incubated, you would not get the chicken. Or you took the egg yolk and incubated that, you would never get a chicken. You would never get, you'd only have half for life. And so there's a lot of individuals who maybe ate egg whites for 10 years. And they created this nutritional imbalance in their body, because as humans, we always ate the entire egg. And then, of course, unfortunately, we were miseducated by the propaganda. And then we decided to, and now we have to unlearn and relearn. And so as people relearn that, oh, cholesterol's not as bad as it was made out to be, and still makes it. And now people are starting to eat eggs, but we have possibly some individuals who have 10 years of yolks to get back into the system. And that's a lot of egg yolks to eat. And then what do you do with the egg white? You're not going to throw that away. And so with the whole food formulas that we recommend, we're filling in nutritional gaps and imbalances. So the first barrier to healing is malnutrition or nutritional imbalances. The second one is scars. There are a lot of scars that people will have from a surgery or a piercing or a tattoo or just an injury. And in Chinese medicine, there are these acupuncture meridians that flow around all over our skin. It is, think of an energetic highway. So for a chiropractor, it's all about the energy moving throughout the spinal column without any type of interference. So then when the spine is in full alignment, the energy and communication works well. For in Chinese medicine, it's all about the energy or the qi that's flowing through the meridians. And if there's a scar that happens to sever the flow of the energy along that meridian, then the energy stops flowing or it's slow to flow. And that's one of the reasons why acupuncture will work, because when someone receives acupuncture, they're encouraging increased flow of energy along the meridian. But if there's a scar in the way, it slows down the flow. So we identify which scars have not fully healed and where it's preventing the flow of energy. Then the other is food sensitivities. There are individuals who are eating foods that are causing inflammation. Now, many of your viewers may actually experience some sort of bloating or gas or just some sort of irritable bowel related symptoms. And there's got to be a food that has to be temporarily avoided. And then we have to strengthen the body so it can be strong enough to properly digest and handle that food. And so we see actually food sensitivities and allergies on the rise. Peanut allergies, dairy allergies, wheat, gluten, corn, it's all on the rise because unfortunately there's a lot of environmental factors that are creating stress in the body. So we have to identify which foods. And then there are heavy metals. There's lead in our air everywhere. A lot of people think that it's safe and there's no lead in our air because all of our automobiles burn unleaded gasoline, but every single airplane up above is burning leaded gasoline still. And if you go online, your viewers can go and find videos and studies showing that children who live near airports or attend schools near airports have higher lead concentrations in their brains and have a direct correlation with a lowered IQ. Okay.
Wow. So, that's crazy.
Yeah, it's unfortunate. It's unfortunate. So there's lead, there's aluminum everywhere. Aluminum is neurotoxic. We know that aluminum is linked to increasing the risk of Alzheimer's, but we're also seeing that in children who are having aluminum unfortunately injected into their bodies, that potentially creating a challenge. And so we want to look at all the heavy metals. So not only lead, aluminum, but there's antimony, there's copper, there's iron, toxic iron, right? So there's all these heavy metals that we have to, during the evaluation, find out, okay, well, which of these are creating a problem and are creating challenges in the neurological system. And then there's chemicals, right? Glyphosate, Roundup. Now you see all these lawsuits. It's everywhere. Roundup is in the air. It's in our water, unfortunately, for anybody who's aware of Silent Spring by Rachel Carson, right? It used to be DDT in all our groundwater. Now it's glyphosate. And so we have chemicals there. We have chemicals, the air fresheners, right? These synthetic fragrances, those all are known to increase the risk for cancers, colognes, perfumes. These are all just chemicals that get in the body and they get stuck. And so we have to identify which of these chemicals our patients are actually putting in their bodies knowingly and unknowingly, and then help to provide them specific formulas to start pulling it out of the tissues, sending it to the liver, and then making sure that the liver, the kidneys, the lymph, and the bowels are all moving to help these toxins exit. And then the sixth stressor is the sixth barrier to healing. We have our pathogens or biotoxins. That could be parasites, mold, bacteria, and viruses. And I see parasites all the time because a lot of people have never even conducted a single parasite cleanse before they come to the clinic. You know, for those who own dogs or cats, we know we have to deworm the cats. We know we have to deworm the dogs. If you own a horse, you know you have to deworm the horse. But how about humans? Humans are not completely immune to parasites. We get those from eating vegetables. We get them from eating meats. We get them from just swimming in a lake. And then, unfortunately, most people just feed them for decades before they come in here. So those are the 6 barriers of healing. And if people can get those assessed and then have all of those addressed, it's amazing what happens with the healing body and what it's capable of doing.
And I have to tell the audience that I've been into your clinic and I've watched you test. And so many people think we live in the United States. We don't have parasites here. But everybody does. That's the ironic part of that, is that everybody does. They just might not feel them. And as you know, and most people don't, but weird symptoms can be caused by those parasites and get diagnosed as something like neuropathy or paresthesias in your feet, or, you know, lots of different things have these diagnoses, but it's actually the parasite. So, you know, I just encourage people to go in and find out which ones they are. Okay, I have another question for you.
Yeah.
You've written a book, The Pharmaceutical Myth. At first blush, some people might get a little bit defensive, or I don't know what the right word is. What are you talking about? Pharmaceuticals are good for you, and so tell people what the book is about.
Okay, so first off, if there's anybody who's watching this interview, if you are taking any pharmaceutical, do not stop, do not change the dose without the guidance of your prescribing physician, okay? Because many pharmaceuticals are addictive and your body can develop some sort of dependency. So we're just gonna handle that right off the bat. So here's the thing. I was a former pharmaceutical sales rep. I trained medical doctors on withdrawal syndrome. So I trained them on how to deal with it when a patient is addicted to a drug, right? How to slowly wean them off. And then unfortunately, it was to switch them to the drugs I was promoting, right? But that's still something that I train other medical doctor colleagues who are in our area. When I have a client who's doing extremely well, I'm like, okay, let me talk to your medical doctor and I'm going to guide them on how to wean you off properly. Because I even see some medical doctors just tell their patients, oh, just stop the drug, and then they crash and burn, and that's unfortunate. So first off, I train medical doctors on how to address withdrawal syndrome. I train medical doctors on how to identify the common side effects of all medications. And unfortunately, some of these medications actually cause side effects that are so severe that can basically lead to a drug-induced disease. Okay, so this book here was published in the 1960s. So this is a phenomenon that's been known for so long. And so I had to train doctors about the side effects of my medication and the potential diseases that it could also create afterwards, and then train them on what other drugs they could potentially add into the regimen. I also train doctors on drug-to-drug interactions. And so I trained them on all of these things. And then I realized at some point, I was like, you know what? I need to tell everybody what I know, not just these medical doctors who are trying to be as safe as possible for these pharmaceuticals. And so this book here is a compilation of all the patient education handouts that I have been providing my clients over the years, and I put it all in one place. And when everyone goes on an individual goes on a natural health improvement program, they actually have a bookmark on where to start, because I don't have everybody just start on page 1 and read it straight to the end. The first part of the book is talking about all the things that I saw as a pharmaceutical sales rep, all the potential harms. I even discussed the practices in which I actually influenced or educated medical doctors to prescribe more of the medications I was promoting. And unfortunately, there are some things I had to leave out because it really would have put me in a difficult situation ethically, because there are some things that these pharmaceutical companies and their employees, it needs to be known, but also could put individuals really in bad trouble if they got exposed. The second half of the book is really, really important. It's all about eating to thrive and understanding how we became undernourished as a population and what we need to do to not only improve our health, but our kids' health, and then start going to the local markets and demanding improved vegetables, improved methods of raising actual healthy meat sources, and then just knowing what your local resources are. So this here is a book that I wrote really to empower any individual to start gaining control over the health. And it's also my way of trying to disseminate as much of the knowledge I've gained over the decade, over the past 13, 14 years from my mentors. Because at the end of the day, I don't want to know it all, and I don't want to have to explain it all. And as individuals gain the information from here and the knowledge of here from this book, I hope my whole goal is that they become in control of their health and they continue to be healthy and happy, and then they can pass it forward, pass it to their children, and eventually down to their grandchildren.
That's awesome. I so much appreciate your knowledge. And everybody on this call, as you can see, Dr. Roliz knows his stuff. And I just want to tell you a little personal experience. I had some issues with some surgeries and antibiotics I had to take, and I got into a bad place. And it happened to be with some parasites. And, doctors aren't really good patients. And we try to be our own doctor. And I tried to navigate my way through this and get rid of these things that were actually causing some pretty severe symptoms. And I have to tell you, within 3 or 4 days after I first came to Dr. Roliz, this several years worth of battling this stuff just started to go away. Like, are you kidding me? It didn't take that long. I think it was going to be, I know it's a journey and I'm not done, but I just want to encourage people, and give them hope. I was talking in my office about giving people vitamin H, which is hope, and encourage them to come to you. So how would somebody get in touch with you and make an appointment? Tell us what that visit looks like and what to expect.
Sure. Yeah, you can always visit our website at NHI Center, so Natural Health Improvement Center, nhicenter.com. And I encourage you to look around our website and watch some of the video testimonials of real people who've gone through our natural health improvement program. Now, obviously you experience some quick relief. It's a little different for everybody. Some people, it takes a few days. Some days for some people, it could be a week or 2 weeks.
Sure,
Everybody's healing journey is different. And I always, and so when people come in, after they've gone through our website, after they've heard of a friend receiving our services and following our recommendations, and then they come in, and our big thing is just making sure you understand what our process is. And so we have individuals come in and fill out a thorough intake questionnaire. It takes approximately 30 to 40 minutes to fill it out. And we want to uncover your entire health history. We want to understand how you got to where you are today. And then when you're in the office, we're going to run some actual physical tests, so heart rate variability. And I do work with individuals remotely too as well. So for in the office, in the clinic, we'll run a heart rate variability, we'll run some blood pressure readings, we're going to test your zinc status, we're going to actually then go into a deep dive of your symptoms. And so of the things you want addressed, we typically ask a couple of questions. When did it start? How is it impacting your life negatively? How severe? How often? What's the duration of it? Because I'll give you an example. If someone has migraines, maybe they have migraines 20 days out of a month. And be like, okay, 20 days out of a month. When was the last, when did your migraines first start? And sometimes they'll say, oh, when I was 16. Okay, so our goal is to get you to 15 years old. All right. And so if someone has 20 days within a month with migraines, our goal is to drop it down, help the body heal and support itself. So then it ends up being 15 days a month, then 10 days a month. Then we don't want it to be migraines. We want it to downgrade to just headaches, because typically it goes headache into migraine. We want it just to stay to headache, and then we eventually want the headaches to go. So we like to do a thorough intake on your specific health challenges and learn more about it so we can track progress. If we can track progress, you can stay encouraged on your natural health improvement program and get to the point where we conduct a re-exam. Okay. And so at the end of the initial phase that we like to work with, we have a re-exam where we're going to have you fill out that same questionnaire. And then we're going to compare the scores from the first questionnaire to the second, and we're going to see how much it came down. And that enables us to determine your rate of recovery. Because at the end of the day, everybody has a different rate of recovery. Some people can heal very fast. Some people, it takes a little bit longer. And that also is dependent upon how close you follow recommendations and also stay positive, right? Positive thinking is just huge. I love that vitamin hope. As long as people remain optimistic and do what they can, it's amazing what the human body can do. So that's the process. Initial evaluation. We like to do a separate appointment with the report of findings and report everything we found, what we recommend, and what the process will potentially look like for you. And then we move through the natural health improvement program, and then we do our re-exam, and we determine your actual rate of recovery and make some additional recommendations from there.
That is a process, and I've gone there to your office. It's a very comfortable place. It's the testing. You don't do anything that hurts. It causes pain.
Yeah.
So when somebody goes in, I just want them to know that it's a very comfortable. The testing is easy. It's not painful in any way. And whether they're just experiencing a few little things, every once in a while, or if they, have really quite serious things, I'm sure you see all ranges of that. Am I correct in that?
We see everything. We see people who have very few issues. And then our job is to make sure, okay, let's ensure that these issues don't progress to anything more severe. And let's get you to ensuring you're always optimal, right? And then we get people who have multiple diagnoses, are on multiple medications, who have gone through all sorts of surgeries, and they've had it. And they're like, with every surgery or every additional medication, there's always additional complications, and I just need a way out. And so we start to strengthen the body, and we start to see how they respond. And then we start working with their medical colleagues and starting to have that conversation. I'm like, okay, maybe it's time you could speak with your prescribing physician. This particular medication, probably you don't need anymore because your blood pressure is normalized or your blood glucose has been stabilized. And so a lot of that can be managed and balanced when the organs are healthy. And we do that by nourishing with good foods and herbs. So it's a process, but we see simple cases to all the way some really difficult cases. And I wish it was just all the easy cases, but we're here again on our mission to help as many people be healthy and happy. And we'll take some of the hardest cases where individuals have seen doctor after doctor after doctor. So if your viewers go on, watch some of the video testimonials, you'll see that some parents have even taken their kids and seen specialists after specialists after specialists. And finally, when they came into our clinic, they were able to receive finally answers and solutions to what they were dealing with.
And Doc, your focus is not to give somebody this diagnosis of this kind of itis or this kind of whatever. Your focus is on returning their body to health, irrespective of what's going on.
Exactly. The entire Western medical model that it came from as a pharmaceutical sales rep, it's get a list of symptoms or lab work, give a diagnosis, which is a label, and prescribe a drug, right? It's just like, take this drug for this health problem. And unfortunately, most people who are out there trying to figure it out on their own, when they've realized the medical doctors don't know everything, they're like, well, I'm taking this drug, it's not working. And they go online and they'll Google supplements or herbs for this health issue. And that's still sometimes they get lucky. Sometimes maybe they find a supplement that works, but sometimes they're like, nope, didn't work, or it worked a little bit and then stopped working. And that's still that model of take this for this. And my job is ultimately, let's get to the root cause. Let's figure out what 6 barriers to healing your body's dealing with. And then let's find exactly what herbs and what nutrition and homeopathy formulas your body needs to address those 6 barriers of healing. And then it's amazing what the body will do after that.
I think a lot of people are going to find that very comforting, because there's a lot of fear, associated with the medical model that's actually been amplified over the last 3 years, and to go somewhere where you look at health. We'll get you to health. We're not going to diagnose you with this, this, and this, and try to treat symptoms. And I think that's what more and more people are moving towards nowadays, is staying healthy, getting healthy, and staying healthy. How can, is there someone who can help me do that? And I think you're a part of a really great team that someone needs to go to, find out what their status is, so they can head something off the path if something is starting, as well as something that's well into the progression of some kind of problem that they have. Is there anything else you'd like to add, Doc? I think we've done pretty good so far.
Yeah. We've covered quite a lot. And to anybody who's watching this, you and I, we share mutual patients, and I've seen amazing things happen when we can get all the detox organs, the liver and the kidneys and lymph, going appropriately with the proper herbs and nutrition. And then when I recommend them to your facility and they receive the laser and the neurofeedback, I see that the brain is actually further letting go more heavy metals and chemicals. And then when they come back to our clinic, we make adjustments to their liver, kidney, lymph detox support, because those adjustments are important to making sure that those toxins don't recirculate, get into the brain, cause inflammation in a different region. And so, it's really important that, and I'm just happy to see, our mutual patients getting some enhanced healing improvements. And so for anybody out there who's listening and watching this video, it's, I don't care if you see me or you see another colleague, but just know if there's any health issue that you're dealing with, keep searching, keep finding help. You don't have to figure out on your own. That could take decades if you ever do get to the solution. You can, if you want to get trained by me, I am training associates to do what I do. I've trained practitioners across the country. I have a whole other websites designed I have all of my courses online available for clinicians. And so if you want to get trained as a clinician, that's great, because then you can better serve your family. But at the end of the day, if you have any health issues, or you have a child that has health issues, reach out to Clear Mind and the doctor there, Dr. Jon Harmon. Come give us a call if you have any questions, but find somebody to work with. Build that health team, right? I actually go and see Dr. Harmon for my neurofeedback work, and same with my son and my family. And, I also receive chiropractic care regularly. I get acupuncture regularly. I have a colleague who's assessing my nutritional herbal status regularly too, as well. And just build that health team, because at the end of the day, when you have that health team and you found the proper clinicians that you want to work that resonate with you, and you can now have a path to ensure that you're going to be healthy and happy, and then you can be healthy and happy to help your children reach their full potential in life. So that's my final words, and that's my final message that I have for everybody.
That's awesome. I just want to say at the end, and just kind of a little disclaimer, neither you nor I were diagnosing or proposing any kind of treatment for any kind of disease. That's not how we look at things anyway. We look at the health of the body and getting it to optimal health. So thank you so much for taking the time to do this video. I think it's going to help a lot of people. And I think that's a wrap.
Sounds good, Doc.
All right. Well, we'll see you soon, either in my clinic or yours. And we'll wish everybody a happy and healthy day.
Absolutely.
Talk to you soon. Bye-bye.
Bye-bye.